Well, Health Minister Sylvia Jones is making an announcement in Brampton right now. Let's listen in live.
We have recently made it easier for U.S. licensed nurses and board-certified physicians to move and practice in Ontario. So far this year, nearly 1,400 nurses and more than 260 doctors have already chosen Ontario as their place to practice. We are also transforming frontline healthcare in our communities through our government's Primary Care Action Plan, supported by our historic investment of $2.1 billion. And today, we are here today to announce that we are launching our next call for proposals to create and expand approximately 75 primary care teams through a $250 million investment that will connect 500,000 more people to a primary care clinician. This brings us another step closer to connecting everyone in Ontario to a primary care clinician by 2029. In June, you may remember we announced a $235 million investment, which funded more than 130 new and expanded primary care teams to connect more than 300,000 people to primary care. And many of these teams are already accepting new patients. This, of course, includes supporting the North Peel Family Health Team through an investment of more than $1.1 million to attach up to 2,500, and did I get that right, Anne-Marie? Yep. 25 patients to primary care, one of several local teams who have received funding. And last year, we invested $110 million in primary care teams to help to connect almost 370,000 more people to primary care in their communities. I am thrilled to share that the Healthcare Connect waitlist has already decreased by more than 98,000 people, over 42%.
Wow.
Our plan is working.
Yeah.
Ontario continues to lead Canada with our unprecedented investments and rapid actions to strengthen the healthcare system. Through our plan to add over 300 new primary care teams across Ontario, connecting 2 million more people to publicly funded primary care by 2029. And the recently passed Primary Care Act establishes primary care as the foundation of Ontario's healthcare system and sets out 6 clear objectives for Ontario's publicly funded primary care system. Those are province-wide, connected, convenient, inclusive, empowered, and responsive, to ensure people know what they can expect when connecting to primary care, and that we have a primary care system built for decades to come. Thank you again to the North Peel Family Health Team and all the healthcare workers and primary care leaders and organizations in Brampton and across our region who provide world-class care to patients and families in their community. It's now my pleasure to invite MPP Prabmeet Singh Sakaria to share a few words. Thank you. Stay well.
Thank you, Minister Jones, and great to be here. And what great news for Ontario communities, and a special story right here in the city of Brampton. It's a pleasure to be here, and thank you to the North Peel Family Health Team for hosting us and for everything you do to provide exceptional care across the city of Brampton. I'm also delighted to be here alongside my colleagues, Minister Jones, who you heard from, and my Brampton colleagues, MPP Williams and MPP McGregor as well. Today's exciting announcement is one more way our government is continuing to build on our progress to connect everyone in Brampton and across Ontario to publicly funded primary care by 2029. Our last call for proposals in the spring saw several primary care teams right here in Brampton receiving funding to connect over 20,000 people to primary care in our community. And through a previously announced investment, our government is providing primary care teams with $142 million in operational funding over 3 years to recruit and retain healthcare workers. Funding can be used for non-physician team members, such as nurse practitioners, registered nurses, physician assistants, and pharmacists. Our investment in primary care is one more way we are growing our province's highly skilled workforce and ensuring people and families have access to high-quality care closer to home for generations to come. Thank you again to the North Peel Family Health Team and all the healthcare workers and organizations in Peel who provide tremendous care to patients and families and contribute so much to the health of our communities. Now it's my pleasure to invite MPP Charmaine Williams to say a few words. Thank you.
Hi, everyone. You know, I've seen firsthand the positive impact that today's announcement will have on communities across Ontario. Right here in Brampton, several outstanding teams are receiving fundings through the last call for proposals, and I'm thrilled to see some of the recipients here today for this announcement. I want to extend my heartfelt congratulations to those recipients. North Peel Family Health Team, Wellfort Community Health Services, and Queen Square Family Health Team. Congratulations. Your work is proof of what is possible when we put people first and build strong partnerships. Investments like this not only strengthen our healthcare system, but also empower frontline workers and community partners who dedicate themselves every day to improving health outcomes across our province. It is your passion, your innovation, and your pursuit of better care that makes initiatives like this so essential to the future of healthcare in Ontario. And I just need to say a special thank you to Minister Jones for your commitment to this healthcare system and everyone in here. And of course, the next person I'm going to invite to the podium, Dr. Jane Philpott, the chair of our government's primary care action team, to say a few words. Thank you so much for all that you've done to help us rebuild our healthcare system. Thank you.
Thank you, MPP Williams, and good morning, everyone. It's wonderful to be here at the North Peel Family Health Team. With the support of the Ontario government, teams like the North Peel Family Health Team are expanding access to care, bringing more services closer to home for people across the province. These teams are the front door to our health system. They are led by family doctors or nurse practitioners, and they provide timely, comprehensive care that makes a real difference. Over the next year, even more people will be connected to care through these teams. So today we are building on that momentum. We are officially launching the next call for proposals that will attach 500,000 more Ontarians to primary care. Communities across the province will be eligible to apply, and Ontario health teams and their primary care networks will play a critical role in working with local primary care clinicians and organizations to submit proposals. The successful teams will be announced in the spring of 2026, and there will be more opportunities to apply in future rounds. I want to thank in particular today the incredible work of clinicians and teams who are, as Minister Jones said, attaching patients through Healthcare Connect. Through their dedication to this, the Healthcare Connect...
We've been listening to a press conference with the health minister announcing a new investment of about $250 million. This is all to connect 500,000 more people to a family doctor and a primary care team in the province.